My name is Marcie Seidel. I'm the Executive Director of Drug Free Action Alliance, which is a statewide certified prevention agency which has been in existence for more than 25 years, with a mission of leading the way in promoting healthy lives through the prevention of substance abuse and its related problems. We are so honored today to welcome former Deputy Director for Demand Reduction in the White House Office of National Drug Control Policy and former President of the American Society of Addiction Medicine, Dr. Andrea Barthwell. We welcome her to our state. We are so grateful to have also Mr. Paul Coleman, who is the CEO and President of Maryhaven, the largest provider of behavioral health care in Central Ohio. And we are also privileged to have Dr. Peter Rogers, who serves as Medical Director of the Southern Ohio Opiate Treatment Program and has worked exclusively with substance-abusing adolescents and their families. We are pleased to bring these individuals together with nearly a combined century of experience in helping neighborhoods, families, and individuals deal with substance use and abuse. One of the biggest public health issues that states and our nation is facing is the conundrum of marijuana being used as so-called medicine. States that have allowed this have not seen lives improve, but instead have seen communities divided, rates of marijuana use by children rise, and traffic crashes and fatalities because of marijuana use increase. To help all of us understand this issue, I have the great privilege of introducing Dr. Andrea Barthwell. President George W. Bush nominated Dr. Barthwell in December 2001 to serve as Deputy Director for Demand Reduction in the Office of National Drug Control Policy, and the United States Senate confirmed her on January 28, 2002. As a member of the President's Sub-Cabinet, Dr. Barthwell was a principal advisor in the Executive Office of the President on policies aimed at reducing the demand of illicit drugs. In addition, Dr. Barthwell has served as President of the American Society of Addiction Medicine and received the Betty Ford Award in 2003. Dr. Barthwell founded and is currently CEO of Two Dreams Outer Banks, an individualized addiction treatment program rooted in the principles set forth by the American Society of Addiction Medicine. I now introduce to you Dr. Barthwell.
Thank you. It's really my great honor and privilege to be here to talk to you today. I'm in Ohio because as a physician, I'm concerned about our children, I'm concerned about our citizens. And with the spreading social, political, and medical acceptance of marijuana, we need to update and provide accurate information on the use of marijuana. I'm here today with the Ohio Society of Addiction Medicine. I spoke to that group this morning, briefing them on the American Society of Addiction Medicine white paper on the physician's role in the treatment of individuals with diseases using marijuana as medicine, and also a white paper that we developed that addressed specifically state ballot initiatives to legalize marijuana. As a policy advisor to the nation and a practicing physician treating people with chemical dependency and their families, I've seen the emerging epidemic and threat due to relaxing the view of marijuana among our young people. Prior to going to ONDCP, I served as the medical director of the largest adolescent treatment system in Illinois, and it was quite common then to hear young people say that marijuana can't be bad for you, it's a medicine, isn't it? And one of the strongest prevention tools that we have is perceived risk among young people, because drug use is a preventable behavior, but addiction is a fundamental yet treatable disease of the brain. And we undermine, rather than undergirding, our prevention principles as we move across the country, legalizing marijuana as medicine for sick and seriously ill individuals. The AMA and the Institute of Medicine have written about this, and what they've called research in the molecules in marijuana as a potential tool. The real story here is that we are on the verge of a new era, an area of emerging medication development that interacts with the endocannabinoid system, which is the most highly represented biological receptor system in the body, both in the brain and the periphery. And we're going to make great strides in treating symptoms and diseases by developing single molecule tools to interact with that system. But we are a long way from knowing how to interact with it, and we certainly do not encourage the use of a smoked medicine. For us as physicians, it's a non-starter. We know that smoking marijuana increases the euphoria and its dependence potential. And we need a robust body of data to inform us in our consultation with sick and dying patients about how to relieve their suffering. We need standards on composition, we need standards on purity, we need standards about potency, and we need standards on effectiveness. And the most that we have seen thus far is an anecdotal finding that marijuana gives people the munchies. That anecdotal finding led to the National Cancer Institute to partner with the National Institute on Drug Abuse to develop Marinol, a medicine that has passed the test of modern medicine, received FDA approval, and can be used for that condition. In all other studies and head-to-head tests of marijuana in either double-blind placebo-controlled trials, the gold standard of medicine, or straight-on studies of marijuana in sick and dying patients, marijuana did not do as well as other medicines that are currently on the market. The American Medical Association, on its Council on Scientific Affairs, reviewed all the literature twice when responding to recommendations that they endorse bringing marijuana forward as a medicine, and concluded that there is no instance where marijuana is superior to anything that's currently on the market. There is no need for it, there is no room for it, there is no place for it in the physician's toolbox. We need safe and reliable medications. Marijuana is unreliable, it's full of contaminants, bird droppings, animal carcasses, and it exposes the sick and dying to a number of potential problems that can worsen their condition. It is also associated with a high substance abuse rate and substance dependence rate. 60 cents out of every dollar that we spend on drug treatment in this country is used to treat marijuana dependence. Also, the FDA is our protection against the quality of the product, the standardization of the product. If a batch gets on the market with a contaminant, it can be recalled. We have a system to track from the factory to the pharmacy and into the patient's pill bottle the medications that have gone through that review. Marijuana does not meet any of the tests of modern medicine. We need safe, effective, and well-controlled research, reproducible chemistry that can be promoted by and accepted by experts. So the American Society of Addiction Medicine, in reviewing all of the other findings of medical bodies, expert bodies, government, and the research, concluded that we, as a physician organization uniquely qualified to speak on this issue, reject the role that these kinds of initiatives foist on us to act as a gatekeeper, to make a recommendation for an individual to use a product that has not passed the test of modern medicine. We're also encouraging and working with our partner medical organizations to encourage their physician members to reject the role of having to certify that the patient has an illness that might qualify them under these kinds of laws and regulations and ballot initiatives to have access or use a defense against their possession of marijuana. We believe that we can make progress here, but we are only going to set modern medicine back by over a century if we persist in allowing individuals who are not qualified to rule on what is a medicine and the quality of data being presented, or if they're basing it on the anecdotal evidence provided by one veteran in a wheelchair who says he feels better using marijuana. So we reject these ballot initiatives. We urge you to stand with the public health, and our young people, and reject it too. Thank you very much.
Thank you, Dr. Barthwell. Next, I have the honor of introducing our next guest, Mr. Paul Coleman. Mr. Coleman has 29 years experience in behavioral health care and has been President and Chief Executive Officer of Maryhaven for over 21 years. Maryhaven is Central Ohio's oldest and most comprehensive provider of behavioral health care with a specialization in addiction recovery care. And in terms of the number of patients admitted, it's the largest provider of behavioral health care in Central Ohio. Prior to his service at Maryhaven, Mr. Coleman was Director of the Governor's Office of Recovery Service with statewide responsibility for alcohol and other drug policy. And prior to that, was engaged in the private practice of law. In a different role, I've had the privilege of working with Paul on various issues, and so I'm extremely pleased to welcome Paul to the podium.
Marcie, thank you very much for that kind introduction. As Marcie has told you, Maryhaven is the oldest and most comprehensive provider of behavioral health care in Central Ohio. We are also 60 years old this year. This is our 60th anniversary. We were founded in 1953 as a halfway house for women alcoholics. Ladies and gentlemen, in 1953, when Maryhaven was founded, marijuana was a presenting problem for many of our patients, and it is a presenting problem for our patients today. Marijuana, without question, is the gateway drug for the vast majority of our patients at Maryhaven. Out of the 7,000 patients we cared for last year, I would be surprised if more than 5% said they had never used marijuana. And more troubling, marijuana is the drug of choice for over half of our adolescent patients at Maryhaven. We have about 148 adolescents under our care at Maryhaven, most on an outpatient basis, and they tell us marijuana is their drug of choice, and that sometimes it is easier to obtain marijuana than it is to obtain alcohol. The side effects of marijuana are well known. They include addiction, extended periods of lethargy, and motor vehicle collisions. When I was practicing law, I had a client tell me once that the difference between beer and marijuana was this. With beer, you don't see the red light. With marijuana, you see the red light and you don't care. So the use of both while operating a motor vehicle is a problem, and law enforcement right now in our state and other states are beginning to educate the men and women who are the front line of law enforcement about how to detect the influence of drugs other than alcohol. Marijuana is one of them. Medical marijuana seems to be an enticing argument, but as Dr. Barthwell has eloquently put it, why would we want any other process other than the scientific process involving FDA, review, rigorous scientific testing, and approval? Why would we want that in Ohio? In conclusion, we had 7,000 patients receive care at Maryhaven last year, and I doubt that we could find any of them who would have a thing good to say about marijuana. Thank you for your attention.
Paul. And finally, I have the pleasure of closely working with our next speaker, Dr. Peter Rogers. Dr. Rogers and I met when he was at Nationwide Children's Hospital, and he was a valuable resource to me and to my staff whenever we had questions or issues regarding substance abuse. Dr. Rogers is now the Medical Director of the Southern Ohio Treatment Program in Southeast Ohio, and is vocal about the issues that marijuana use and abuse brings to families, individuals, and especially children. I welcome Dr. Rogers to the podium.
Hi, I'm a pediatrician. I'm also board certified in addiction medicine, and since 1985 I've been involved in the assessment and treatment of several thousand adolescents with substance abuse problems and their families. I think that after alcohol, marijuana is the most dangerous drug for adolescents. It's uniquely devastating. I mean, it takes away their ability to learn, their desire to learn, it takes away their motivation. I just can't understand why the people of Ohio would want to legalize one more dangerous, addictive drug. For me, who I've seen the devastation of marijuana use in adolescents firsthand for so many years, I'm really concerned about this issue. Most often now I'm working with young adults who are opiate addicts, most often heroin. And the heroin addicts are also addicted to other drugs, most often marijuana. And I have found it easier to get people off of heroin than I can off of marijuana. So I just hope the people of Ohio will strongly consider not legalizing another dangerous drug in our state. Thank you.
That concludes our presentations, but we're certainly welcome to respond to questions. I think all of our presenters are willing to do that. So if there are some questions, we're glad to field those at this time. Yes?
I have a question for Dr. Barthwell. From a national perspective, what are some of the effects that you've seen in states that have done this? What evidence are there that this isn't working in other areas of the country?
I have a son who lives in Oakland. They have a university there, it's called Coleman, They teach people how to create grow operations. He can't afford to live in San Francisco, but he's in the Bay Area, so he's in Oakland. When I visit him and we drive around the neighborhood, it's quite common to see people sitting out on their stoop smoking marijuana. He went and was going to change his apartment and move into a bigger space because he works out of his house, and we looked at a space where it had been a grow op. It had been raided by the police, and the person had been evicted, and the interior of that particular apartment was completely trashed. I worry about, as an African-American woman who lives in Chicago, the effect that liquor stores have had on my neighborhood, and I've worked a lot in prevention about that. You can find liquor stores more easily than you can find it at a church in some of our blighted areas of our community. My husband's from Detroit, and Michigan has its own issues, and it has marijuana law, and I've spent time watching Detroit's decline. My hometown of Jackson, Michigan, since it was passed there. I've got lots of experiences with this, but what was I was more profoundly affected by than all the liquor stores that we've tried to close in our community in Chicago were the buy stations in Oakland. They were even more plentiful than the liquor stores that I've spent my life trying to shut down. I think this has an effect on our children. It communicates a message to them about their value. It has an effect on those communities, those rural operations where people don't want to live next door to them. It has an effect on our highway safety. some of the counties in LA are trying to push back. I've worked with the Attorney General in LA County who's trying to exempt itself from the California law. These people move in with a vengeance. When you have defense for carrying marijuana, they create the illusion that the massive grow sites are cooperative, that are being put together to help sick people get access to this. In these states, there are no laws that prohibit someone under 21 from getting this or even requiring parental permission. So kids 18 to 21 can get this. 1 or 2 high school seniors in a large suburban high school can supply that school on a weekly basis with enough marijuana for everybody to be high every day with the amount that's allowed under these bills. These are kids 18 to 21, they're on college campuses. Without parental permission, they can get these cards. It's been devastating to watch how this has affected these communities, and it really makes me sad, looking at the environment as it's changing around my side of Oakland, my hometown of Jackson, Michigan, and the urban blight in Detroit. And I don't think you want that.
Ian, if I could just follow up Doctor's response. California was one of the first states to legalize marijuana. And within months, there were more marijuana outlets in Los Angeles than there were Starbucks outlets. So that gives you an idea of the proliferation. And the people of this state need to ask themselves, is that something they want to have happen here?
Dr. Barthwell, let me ask. I always take a deep breath. There is a reality here, certainly a public perception reality. The President of the United States smoked pot when he was in high school and college. He turned out okay. And what we're talking about in Ohio is medical marijuana. If a 77-year-old woman is dying of stomach cancer, as an example, I think a lot of people would say, why is the government involved in preventing her if she feels this gives her relief from stepping in and preventing that? Why should the government be involved?
Because it's not just about her. It's really about our young people. It's about the environment that grows up around that. And my 77-year-old patients with stomach cancer would get medicine from me and not a recommendation to use marijuana. In fact, in the old and infirm, you're more likely to have a paranoid reaction or a negative affect in using marijuana. When you talk to people as they age, they don't want to use marijuana. This is not about your 76-year-old grandmother, gripping at a marijuana joint on her deathbed. It is not about her. It's about a 30-year-old who's living in his mother's basement who still wants to smoke marijuana. He's got a shoebox top under his bed where he separates his weed from the seed. It's not about your 76-year-old grandmother who could have better care and who actually would be adversely affected by having access to something with pesticides and contaminants and the psychotic episodes that develop in response to it, and something that is completely unregulated, not characterized from a scientific perspective. It can't be delivered in a reproducible way to her.
But the 30-year-old would still have that pot in the basement anyway, right? I mean, medical marijuana changes the dynamic so that it becomes available for those that are sick.
We don't have medical Marlboros, and we don't have medical Scotch. Why is it that we don't have them? There are people who...
But alcohol is legal.
There are people who use a little alcohol for some sedation and for pain control. Yeah, and they do that before they advance themselves to seeing a doctor and getting more extensive care for whatever ails them. But the people who are using a nip of Scotch, they're not treating a stomach cancer pain. They're treating, a thumb that they hit with a hammer when they were on the roof that afternoon. So there is this misperception that this is something that the sick and dying really need in order to ease their suffering. That 76-year-old woman, my 85-year-old mother-in-law who died of brain cancer last year, got medicine for that. She didn't get marijuana. We didn't offer her that. And she died without pain. If we'd given her marijuana, she would have died in a stupor, unable to communicate with us, but in pain. There's no real clear and compelling evidence that marijuana works with the pain receptors in the way that the opioids do. And I know you've heard it, people have said, I don't want to use opioids because it's trading one disability for another. I suggest to you that it's probably because it's not used in a deft way, in the hands of a skilled physician. And perhaps what happened was those doses were pushed by somebody that may have developed a dependence on the opioid. But, I didn't want my 85-year-old mother-in-law to get marijuana when she was dying with a brain tumor. I wanted her to get real medicine, something that we knew what she was getting. And I think that's what you would want for your 85-year-old mother.
My grandmother actually died of stomach cancer, and she was getting marijuana, so it helped her. But that's just a personal experience.
One of the arguments made by medical marijuana advocates is that, well, if you legalize it in this way, you can regulate it when you're using pesticides and bird droppings. Well, that'll go out the window because you can regulate it. What would you say to that?
We've got regulated marijuana. That molecule that they're going after in the marijuana is already in a pill. Now, there are some issues with that pill, but again, if you teach a patient how to take it for its best effect, they can get the effect of it. It's not something that gives you the rapid onset of action like smoking a joint would do. But, I have seen cancer patients who've used it who take it in advance of their trip to the hospital before they get in that cycle of smelling alcohol, thinking about their chemotherapy and becoming nauseated. So it works quite well when you have not allowed that nausea to be conditioned relative to the treatment. And individuals who have brain metastases who are going to get radiation will use it in advance of that. But those who have those brain mets, and a good friend of mine that I knew from med school died of lung cancer that had metastasized to his brain. He didn't take Marinol on the days that he was going to work. He only took it on the days that he was getting radiation therapy. But he too wanted a pill that had passed the test of science. We have that available to us. And they're reformulating it now so that it's a nasal spray, it can be delivered more quickly. Some of the problems that people have had with it are being overcome by reformulation. And there are lots of new medications under development that are going to take advantage of molecules in marijuana. But we are not going to subject our young people to untold supplies of cartel-provided marijuana. Because don't fool yourself and believe that this mature industry that distributes drugs illicitly in this country is going to go away just because you can buy Marinol at the local Clark gas station. It'll operate in secrecy at great profit and continue to sustain itself and bring down every democratic process in every country from Canada to the farthest reaches of South America in this hemisphere. And it will have the cover of an ill-conceived law.
The people who are putting forth these ballot initiatives and whatnot, what are they missing? I mean, what aren't they seeing that you see?
I think that some of them are using the sick and suffering to advance a policy agenda. Some are upset that marijuana is illegal. As I said, if it were legal, you wouldn't have medical marijuana because they'd have access to it. So they're using the term medical. There's no such thing as medical marijuana. There's just marijuana used by sick people, and sometimes not so sick. In one state you can use it for writer's cramp. They're using people who are sick and suffering to advance a policy agenda in a very slick and well-funded way. And these people who are, working with your sick and addicted in the state every day don't have money to put together press conferences and, fly people around the state and hire lobbyists to advance their point. All they have is, a reasonable argument.
I'll have reason to believe that that's going to happen here in Ohio. We were very early in this ballot initiative.
Yeah, we are fairly sure that they've been.
Yeah, so that we can
We've been tracking this for quite some time now, and there are no less than 3 initiatives out there now to put it on the ballot, which will be in our Constitution. They're collecting signatures now. They've gone through the proper process to get them to the point where they can now collect the 380-some thousand signatures. And so as we kind of follow, and as just to follow up to the thing, that we know that they're going to do it because they're fairly transparent. These are large pro-marijuana groups that have been working on these issues for 20, 30 years. And they've gotten to the point now that their transparency is that they have told us, through their websites and other papers, that this is one of their strategies to basically legalize marijuana. And they're brilliant at it because they're getting close to doing just that. If you look at the latest initiative that's been put out to go out for signatures, it's not medical anymore, it's therapeutic. And you don't have to have a doctor's recommendation, you just have to have a diagnosis. And if you get a diagnosis, you can have as much marijuana on you as you want to smoke or give away or do whatever you want to. And keep in mind, 1 ounce of marijuana is 84 joints. So when you think someone has a small amount of marijuana on them, that's 84 joints that'll keep them high continuously for 2 weeks. So it will, marijuana will flood the market. And so there'll be a lot of extra, which will get into our kids. But yes, we do think it's coming, and we really want to hear the experts not me.
Well, and one thing I'd quickly add in terms of the experts, the argument all 4 of us would make is please look at the science. There are anecdotal stories, some of them, Jim, very powerful anecdotal stories. I'm not going to discount those, but what I am going to say is this. When the American Medical Association says that there is no value medicinally in this drug, please be aware of the old story of the camel with its nose under the tent. And in fact, the history of marijuana initiatives in the United States has shown this is how it begins, and it ends up with marijuana for recreational use, if there's any difference, as Marcie would point out.
One of the concerns with pain drugs and other drugs that are approved right now is that they're very addictive. Is it not true that marijuana is less addictive than some of those things already on the market?
Marijuana is very addictive, quite comparable to alcohol. And when you're looking at that, you can either look at how it saturates a population of people who are exposed, or of those exposed, how many will go on to develop a problem with it. But because alcohol is generally, everybody has an exposure to that, only a small percentage of the population. The adult population has never used alcohol. We know about 15% of the population will become dependent on alcohol across their lifetime. 17% men, 13% women. There's some gender differences there. With marijuana, it's 11%. So it's in the same ballpark. And we know from looking at patterns of use in the first 6 months, we can just about predict who's going to go on to develop a lifetime problem with it. And those numbers are increasing as the age of initiation is dropping and the potency of marijuana is increasing. Those numbers are starting to shift less in favor of young people.
I'm pretty sure when I call the pro-medical marijuana folks this afternoon for a response, they're going to say, oh, marijuana's not addictive. You know, I'd like to see the science on it. I know, what is it? Are there studies showing that marijuana is addictive?
Yes, there are. There's clear and compelling evidence. There is a dependent syndrome, there's withdrawal syndrome when we stop. And there's brain evidence of it now on the spectrum of PET scans. Also ask them, and they stop. The ones you talk to, ask them when was the last time they lived a day without smoking marijuana. There is always a perception among those who are dependent that they could stop anytime they wanted to. And everybody in this room knows somebody that should, but hasn't been able to. So what we know from prevention work is that if you don't initiate before the age of 17, you are less likely to develop a problem across your life with the substance that you initiate on. And the age of initiation decreasing, our age of initiation nationally in this country is around 12. That means there are some states where it's lower, some states where it's higher, some youth where it's lower, some youth but in general, they are all